what's our schedule for today? We'll just go ahead and run it so that way
when everybody tunes in. So basically today I'm going to spend the first part of this just talking to you, giving you information about tendon injuries, you know, how to help your horse out if should you suspect this is happening, when to call a vet, you know, and just what happens with the healing, and how long it takes, and, you know, what kind of recovery you're dealing with. And then once we finish talking about the basics of what is actually happening with your horse, we can start talking about how to diagnose it, what all we can use, and our different treatment options, especially the ones that we offer here at Bannon Woods Veterinary Hospital. So, you know, we're kind of trying to make it half and a half, 15 minutes of just information on that. And if you guys have any questions, please send them in to us while we're doing this. We're going to check them live, and I will do my best to answer them. So, yeah, so why don't we get started?
Sure. Okay, so let's start with, what are our basic tendon injuries?
Okay, so when you're starting at the lowest level, you're talking about, you know, your sprains and strains, okay? You're not looking at a tear or anything like that, but what this is just a little bit of a disruption to the blood flow to the tendon fibers where they haven't actually torn apart yet, okay? You know, your different bowed tendons can happen. They can be large, they can be small, but you're going to notice a defect and heat on the outside of your tendon, okay? You know, when you start looking at more severe tendon injuries, you start thinking about, you know, core lesions where there's an actual disruption in the fiber in the bottom. And then you're also, you know, tears, and then, you know, your suspensory injuries are a whole different ball game, but that is technically a tendon injury too, but it can also involve the sesamoids. So this is a pretty broad topic we're trying to cover right now. So, you know, I'm trying to do my best to condense a lot of information down into one little talk tonight, okay? So yeah.
So what are risk factors when it comes to tendons?
All horses can suffer a tendon injury, you know, even horses out in a paddock that aren't doing anything. Certain risk factors for those horses that are turned out include, you know, if it's particularly muddy out or they're acting particularly foolish out there, you know, tight turns, fast speed, or anything that can cause trauma to that tendon can really you know, cause injury. However, when we talk about tendon injuries, we think about our sport horses, okay? And whether you be English or Western, if you're doing high speed, unnatural, it's still natural movement, but lateral movement, jumping, you know, stuff like in reining where you're doing tight spinning or sliding stops, or even in with your barrel racers, your fast speeds and your hairpin turns, high speed can really, you know, be a contributor into tendon injuries. So yeah, those would be our big risk factors.
And so comes back to why we're talking about this today, but why are these injuries such a big deal for our horses?
Yeah, so when you hear that your horse might potentially have a tendon injury, or if you see some swelling on the back of their leg, you know, immediately it's kind of a scary thing to deal with, just because tendon injuries are known to have such a long recovery time, okay? And the reason this is is because there's very little blood supply to the tendon, okay? You know, horses are fantastic animals. They're walking around on a single digit, and they just don't have the blood supply there. So that's why it takes such a long time for them to heal, and why the injury to a single tendon running along their limb can be so damaging to them, is because they've only got one. They're only walking around on one. So, you know, we gotta make sure we take care of them and catch it early. That's a big thing too.
No hoof, no horse.
No hoof, no horse. No leg, no horse.
Yes. And once a horse injures their tendon, does this become more prevalent? Are they at risk in the future?
Yeah, no, that's a fantastic question. And it is one that I do get asked a lot. And the answer is unfortunately, yes. It's a significant tendon injury, such as a bow, or, even a core lesion that they've sustained, working and that has actually caused a defect. The fact of the matter is that these tendon injuries can take a long time to heal in, and a lot of times if we don't intervene, it's going to form a scar in that area. It's not going to heal in as well. The way the collagen fibers work is once they tear apart, if you don't do something to help brace them and support them and help them heal better, they're going to heal back in kind of a wonky fashion. Okay. And that's not as tight as this. And so those are more prone to being injured again. So that's another kind of scary part about tendon injuries.
Yeah. Which comes back into why it's so important to take care of tendons, and especially if they've had a history of injury.
Yeah, absolutely.
But this is also, I feel like, why we're such huge proponents of getting your pre-purchase exams done.
Yeah. And that's the thing. If a horse has had a significant tendon injury in the past, and it hasn't healed as well as it could have, typically we can find those lesions on ultrasound. And so the importance of a pre-purchase exam and knowing whether you're getting into a situation where your horse may be injured again is really important to you and also the horse. We want them to be able to perform to the level you want them to perform. And we want you to know that when you're bringing this horse home, that you've got one that can withstand the type of riding that you're wanting to do. So, yeah.
And does it discriminate breeds?
No, not at all. I've large and small, all types can get tendon injuries, from your fast, compact barrel racers to your great big, warm blood jumpers. All types can have it. Absolutely.
Sure. What about trailering? Do you recommend wrapping legs for horses in the trailer?
Yeah, see, this is kind of an interesting thing. The opinions on trailering horses vary and how you should do it. A lot of times it's just to protect them from getting nicks. Me personally, my horses, I do keep them in wraps when I trailer them, just because I want to keep their legs pristine. But pretty much it's, it comes and goes. It's what's in vogue and what we're going to do. But personally myself, I do bandage my horses when they travel in a trailer. So, it's just user discretion, and especially if you know that your horse is a monkey, or on the opposite end, a complete saint, that can influence your decision as well.
Yes, definitely.
Yeah.
So for tendon support during exercise, what is your preferred method?
There's a lot of different options. We actually did a video on how to use polo wraps. I don't know if we've posted that yet or not. But polo wraps are fantastic. And the great thing about them is that you can wash them. Okay. And it's easy to just throw them in the wash, and then utilize them again. Personally, I like to recommend tendon boots because I think they're easier. They're a lot more user friendly, and they provide a really good solid protection. However, you do have to keep in mind with tendon boots that if they get dirty, you're putting sweat, they can form a hard, almost a hard surface inside of your boot that's not going to do your horse any favors. So making sure that you maintain all of your equipment and you put on your equipment correctly is really important when using something to protect their limbs. And if you ever have any questions about it, not only can you ask around your barn, but you can ask your vet too. We're here to help.
Absolutely. And we'll take a moment and just say hello to everybody.
Yeah. I'm so glad you guys are all here tonight. So
we see your names as you're logging on. We're so happy that you're able to be here.
Yeah.
Don't hesitate if you have questions. Even if you can't stay the entire time, we can always answer them later, and you can rewind on either Facebook or YouTube.
Yeah. Don't forget to like and subscribe.
Exactly. All right. So I believe it's Allie asked about back on track products.
Back on track products. Yes. The quintessential, here's how I need to rehab my horse. I think that they are good products. I have seen them work in horses before. I've seen them improve healing times. I can't speak to as much of the research behind it, but having, anecdotal evidence, I've been impressed with their product, just the quality of it too. Especially their pillow wraps are really well made. But it may be, it's up to the individual owners, but I'm definitely not against them. I think they provide a quality product and can improve, some healing. And plus I've heard the magnetic blankets that you put on or the jackets are really nice for your back too. I've been thinking about getting one for myself. Yeah.
So when we wrap our horse's legs, polos and standing wraps, how long can they stay on for?
With polos, because you don't have any padding underneath of them, I am a little bit more wary with them. I would only keep them on for the period of time that you're riding, 2 to 4 hours max. Okay, guys, and they should be the last thing that you put on before you get on your horse, and they should be the first thing you take off. Polo wraps, you've got to really take into consideration how you're putting those on. Always remember, push over tendon, pull over bone, tighten over bone. Do not tighten over tendon, because that's how you get a bone tendon, and then we're back to square one.
Yeah. And if you guys want to see that in motion, we do have that video on YouTube where Dr. Kiser is actually going to show you how to properly use polo wraps, standing wraps, even a hind leg standing wrap.
Yeah.
So and you've covered it a little bit, but how do these polo wraps and standing wraps differ? When do we use them?
Okay, so standing wraps aren't really something that you're going to utilize in a horse that's in motion, just because they're gonna lose them. You might put them on like when they're in a trailer or anything like that, but really they're more for a stalled or stationary horse. They're not really as much a performance product. You've kind of run the chance of losing them, even though I feel like they stay on pretty darn well. But they're typically more of a stationary type of support that you keep on a horse, whereas polos, as the name would imply, are used on sport horses or horses in motion, where they originated as bandages protecting polo horse legs. So yeah, that's why they're called polos.
It's the closest thing you can get to bubble wrapping your horse.
Exactly. If we could bubble wrap them all.
We, as horse owners and lovers, we would love that ourselves.
I just wish we could keep them in bubble wrap all day long. But at the same time, then I wouldn't get to come out and visit people as often.
So speaking of injuries and home visits, first of all, what are our signs going to be for tendon injuries if you think your horse has one?
Okay, so the scary moment. Your horse comes in and is off, okay? Typically, the first thing you'll notice is a head bob. Now, some horses with a tendon injury aren't off. They're not lame. They don't come in lame. But typically, they do show some signs of pain and discomfort in their movement. The other thing you're going to look for on the back of your horse's leg, there's that tendon that runs along the back, and typically the profile is very straight, okay? A lot of times with tendon injuries, especially your more severe ones, unfortunately, you can notice a profile, okay? There will be an area of swelling. And one of the ways I like to check for it is to feel heat in the area, because an acute tendon injury will have heat to it, because blood has rushed to the area, okay? And the way that I like to compare this is to feel the injured leg with one hand and then feel the normal leg with my other hand. That can really give you a good gauge of, whether there is actually something going on or not. That's something you would start with. And then to segue into there, what should you do if that is something that you think is happening? The most important thing, is going to be to stall rest your horse until a vet can get out there and help you determine what extent the injury has happened. And then when in doubt, cool it out, okay? We want to draw the inflammation out of there. We don't want to add more heat. A lot of excuse me, I'm sorry. A lot of people's first instinct is to do something like sweat the leg, which later on can be useful. But in your early stages of inflammation, the last thing you want to do is add in more heat to that. So we really recommend cold hosing, even ice boots for that limb, as well as poultice to help draw that inflammation out. And then once your vet gets there, and once your vet sees you, they may give you certain medications to help draw that inflammation out. But really, we don't want to add any more heat to a hot area. When we first ultrasound that limb, that dark area you're seeing on that ultrasound is not actually the tear, it's a blood clot, okay? Because there has been damage to the area, and that heat in that area comes from that blood and just the inflammation that comes in an acute process. So it's going to be at least 72 hours of just cooling the injury down before we can do much else.
Sure. And Rhonda actually asked about using sport boots specifically with trail riding.
Oh yeah, I'm a huge fan of keeping your horse's tendons protected, out on trail rides. I, as a former equestrian myself, it's been a little while since I've ridden. I'm trying to get back into it, you guys. But as a former eventer, out on the cross country course, we had to make sure that all of our horses were really protected from the fences that didn't move and brushing up against brush. And it's the same process with when you're out on the trail ride. You never know what your terrain's going to be like. You never know what kind of obstacles you're going to be going over. So protecting with good supportive boots, even just a basic pair of brushing boots could really help protect your horse's legs. I'm on board with that, definitely.
Yeah. And let's see here. Susan asked what the difference between a tendon and a ligament injury is, just to clarify.
Okay, cool. Yeah. So a tendon actually attaches from bone to bone, and it causes movement, if that makes any sense.
It's almost like a puppet.
Yeah, it's like a puppet. You can feel it in your own arm when you use your tendons to bend your fingers on the bottom of it. Whereas a ligament attaches muscle to bone, okay? And it doesn't produce as much injury, okay? So especially on range of motion. So that the important thing to differentiate, especially in horses, you're not going to see as many ligament injuries per se as you are going to see tendon injuries, where it's a specific location. When you're talking about strains and, sprains and everything like that, you're looking more at tendon injuries in horses.
Sure.
Thanks for the question. That's a really good one. It got my...
So we've had two questions sort of about pre-purchase exams, specifically if a horse has had the injury in the past. Is ultrasound our only way of finding these injuries? Are there other signs that a horse may have had an old injury?
Yeah. The first old sign you can look for is just a difference in profile. Symmetry is really important. And if your horse's limbs are not symmetrical, if you're noticing a larger area, that's a pretty telltale sign. Sometimes this can be really subtle. And again, that's why a pre-purchase exam is fairly important, because we've been trained to feel these asymmetries in your horse's limbs, and especially in the tendons. So when you see us coming out and doing your pre-purchase exam and running our hands down the back of their legs and down their suspensories, that's really what we're looking for, are those asymmetries. The likelihood that they have an active injury at that time is probably, pretty slim, especially if they're trying to sell them, and haven't disclosed that, but we can feel these things. And then, as far as other ways of finding them out, ultrasound is probably the best way that we have at our fingertips. You can do something like an MRI, but that requires a lot, whereas an ultrasound, we can tell pretty darn well how well they've healed.
And I think that's what comes down to, if you suspect you may have an injury, call your vet. We're always more than happy, and to make sure you have it winds up healing okay.
Yeah, absolutely. Our number one priority is making sure your horse returns to function and is comfortable. That's our number one priority.
Sure. So, and do you have a preference if there's a tendon injury? Is it safe to trailer, or do you prefer farm calls? That was a question asked by Ashley.
That's a fantastic question. You know, with most of your tendon injuries, other than your completely catastrophic ones where they're severed in half, as long as you do support the limb with, you know, protective wraps, or even, you know, if it's a extreme one, a Kimsey splint, you know, we're talking extremes here. Most of the time it is safe to bring them in as long as you support the limb. But, you know, call us, tell us what's going on, and we will determine for you whether it is safe. We have portable ultrasound. We can come to you. And if there's any question, we'll always, you know, choose the safest decision for your horse. Yeah,
definitely. So once they get injured, what are some things your vet can do to help it heal?
Okay, perfect. Now we get into the really scientific and kind of fun stuff to talk about, because our tendon injuries and the way we treat them have progressed exponentially within the past, you know, 10 to 15 years. And that's a really recent time as far as veterinary medicine goes. So, you know, here at Bannon Woods, we have a few specific modalities that we do recommend. You know, and anytime you're hearing anybody talk about tendon injuries, you know, it's the big three: stem cells, PRP, and IRAP. Okay. And if you're unfamiliar with these, you know, I've got some information for you. We actually do all three here. So, you know, just to talk about the different modalities, what these are essentially building blocks that we are taking from your horse and putting back into your horse to help make a matrix for a scaffolding, even for that tendon to heal itself better. We do intralesional injections of this, where we actually inject them back into the area that is injured, and it can really help reduce your healing time, and it can really also improve how well they heal without a scar, if that makes any sense. So, you know, your different options that we're talking about. So like stem cells are exactly what they sound like. Anytime you've heard talk about stem cells, they are the cells that your horse's body grew from. Essentially, they're baby cells. And we can harvest them from the horse itself. We will determine on a case-by-case basis where we harvest them from. And then we take them and we process them. And then what these do when we inject them into the lesion is they really, really reduce the inflammation, and they lay down that matrix so it can get back to healing. And that allows for really proper fiber alignment in their tendon, which the rest of these all do as well. But stem cells are kind of our gold standard. Okay. And then, you know, on down the line, IRAP, which is interleukin-1 receptor antagonist protein. Say that 10 times fast. And what IRAP does is essentially it counteracts a protein that's involved. I'm getting really scientific, you guys. It counteracts a protein that's involved in injuries and inflammation, and it makes it stop working. So primarily it's an anti-inflammatory, but it really does help healing. And then PRP is just platelet-rich plasma, okay, which we take from the horse and we harvest it from them and spin it down and process it. And then platelets are really good for healing. What it does is it draws growth factors to the area to help expedite healing. So those are our different modalities that we have, and you know, we can assess, you know, which would be right for you and which would be right for your horse. So, you know, those are some things to consider. And then when we get away from talking about, you know, injectables, something that we're going to inject into the site, there's also Shockwave, which we offer here at Bannon Woods. I don't know how many of you all are familiar with it, but what Shockwave is essentially a therapeutic treatment that uses a pulsing, okay, and it's a strong pulsing to create inflammation at the site, which sounds counterintuitive, but it only lasts for the time of the treatment. So it draws in all of these healing factors to the actual lesion of the area and promotes healing in the area. So we're huge proponents of Shockwave here. And, you know, like I said, with your individual cases, we can discuss with you what would be best for you and your horse. So
sure. And then what are our diagnostic options other than, you know, we have our standard traditional ultrasound, but what are our new technologies?
Yeah. So one of the coolest things that we especially have to offer here at Bannon Woods, Candace is actually going to go grab it for us. With one of our ultrasounds, we actually have the Logic View, which is a really awesome way of mapping out a tendon, especially in the lateral view. We did have a live demonstration performed for you guys, unfortunately, but our internet wasn't working. So what I'm having them do is actually roll in the ultrasound to show you the tendon map that I did right before this with Huey. And Candace can pull this up here and maybe I can show you. But what the Logic View does is it allows me to go down your entire horse's ligament, and especially look at that superficial and deep digital flexor, to have a full picture of that tendon. You know, it's almost like a baby MRI, but it's in the longitudinal segment. Okay, so it lets me look at those different areas, all in one slice, because typically what ultrasounds are, they're one slice at a time. And it's something that we're really excited here to offer here, because it's a really informative thing we can do. And especially if your horse hasn't had an injury, or we're doing a pre-purchase exam, this map is a really, really spectacular way for us to just know what's going on in their specific limbs and have a full, broader picture of what's going on. So yeah, we just wanted to talk to you all about that a little bit.
So for treatment options, when we medically intervene, how does that change our recovery time?
And it's hard to say with individual horses, but the research that has been done, you know, on using things such as stem cells, IRAP, PRP, it all varies. But, you know, it may not completely shorten the time, or it may, you know, they may recover much quicker. And by much quicker, I'm talking about going from 12 months to maybe 8, but it will shave some time off. But the primary thing that we really, really like about using these different modalities is how much more solid the wound heals, okay? When we don't have as much scar tissue in that actual tendon, you know, it's going to heal more solidly. The fibers are going to stay in alignment, and the likelihood of re-injury in your horse is going to potentially go down. So that's the real importance. But there have been some benefits that we've seen, especially anecdotally, in speeding up recovery times by using these different modalities. So,
sure.
Yeah.
And it's time for our final question, which was asked on Instagram earlier, but
Wonderful.
Just to explain, why is it so important that we catch these tendon injuries early and have them seen by a vet?
That's a wonderful question. So think of it like a rope, okay? The tendon is the rope down the back of your horse's leg holding their limb together. If it starts fraying, and we don't attend to it quickly and try and mend it and repair it and give it the time to heal it needs, that fray is going to continue to get worse and worse, and can really become a catastrophic injury that your horse may not be able to recover from if it's ignored, or you know, if it's allowed to continue to worsen. Okay, the rope analogy is the best one that I can think of. You know, so it's really important just to, you know, have us come out, take a peek. You know, sometimes at the first start of the stage, an ultrasound, if it's just happened, may not tell us a lot, because they can get a lot of edema and swelling in the area, you know, and we won't be able to tell truly. But with time and pulling that inflammation out, we'll be able to get a good picture, and be able to truly give prognostic information, you know. And we really need to keep these horses still, in a stall, and really start taking care of that inflammation and that injury to the area. So,
sure.
Yeah.
And so just to close out,
yeah,
thank you so much, everyone, for joining us. We really appreciate the support, the atmosphere. I love everyone joining in to say hi.
Yeah, absolutely. No, this has been absolutely wonderful. This is a topic that I really do enjoy talking about. You know, sport horse medicine is really close to mine and Dr. Robertson's heart, and Dr. Rice, our new addition. Yes. She's a wonderful sport horse veterinarian too. So we're just, you know, our goal is to keep your equine athlete competing to their best ability. And we're so glad that we have so many options that that we can give you all to keep them going and to keep them healthy and to keep them safe while they're going.
Sure.
So, yeah.
And just to tell you guys about a couple fun things we have coming up, on February 5th, since you mentioned Dr. Rice, our new veterinarian, Dr. Jennifer Rice, will be holding a education presentation and dinner. So we will be catering the talk, and she'll be discussing equine wellness. And you also have, of course, the chance to meet her, talk to all of us.
Yeah.
So you do not have to be one of our clients to attend. We welcome anybody, you know, any horse lovers, you know, come and join us and say hi.
Yeah, if you want to learn a little something, get a little food, and meet some pretty awesome veterinarians, come on out and meet us. We'd love to talk to you.
And then also on February 1st, we are going to have another live Q&A session with Dr. Robertson. She's going to discuss dental care for Dental Month. So keep an eye on the page. A lot of fun stuff happening, and I recommend topics.
Yeah, absolutely. If you have any questions, or, you know, you want us to talk about something, shoot us a message. That's literally how we landed on this topic, was somebody on Instagram actually asked us.
Glass,
actually asked us to talk about it. And I was like, tendons, I want to talk about those. So perfect. Just send us your questions. Tell us what you want us to talk about. You know, tell us what you want to know more about. We love doing this. So, thank you again, everybody, for coming out tonight, or tuning in tonight. It's been a pleasure as always, and I look forward to doing my next talk with you all. Okay.
All right. Bye, everyone.
Bye. Night, everyone.